is Janie Pack. I'm a OBGYN physician from the States, and I decided to do the 4-week program here with CGI in the Spanish Immersion program for medical professionals, mainly because I will be having a lot of Spanish-speaking patients, and I want to be able to speak to them and consent them for various things without relying on a translator every single time. So I looked into various programs online, and I wanted a program that was tailored for medical professionals because I only had so much time, and I wanted to focus on the context in which I'd be using Spanish. Mm-hmm. In terms of, this program had a ton of really positive reviews, and I had certain hesitancies because I know my own personality, tendencies to be introverted and shy when it comes to speaking new languages I'm not comfortable with, but it seemed like based on the reviews that a lot of people were in the same shoes and felt like they walked away from the program having benefited a lot in improving their Spanish quite a bit. Yeah, so I had learned quite a bit of Spanish all throughout high school and junior high, but not since college, so it's been many, many years. I wanted to rebuild that foundation that I had laid before in terms of verb conjugations, sentence structure, being able to have conversations. My goal wasn't to be able to speak Spanish at a level to talk to another Spanish-speaking professional per se, but to speak at the level in which patients could understand me. The most challenging thing for me is there's a lot of group work and a lot of social activity more than I'm used to. I tend to like to have a decent amount of solo time. So so a lot of the group work and the constant need to interact, which is a big and important part of the program, was a little bit draining on me at times. I had a little bit of doubt regarding how much Spanish people would use on a day-to-day conversation, especially since most of the people who are coming their first language is English, and so it's very easy and tempting to revert back to that. But I think the pre-course preparation and setting a very clear expectation and emphasis on the need and the encouragement to speak Spanish even to your English-speaking colleagues was really important, and it pushed you may not know the vocabulary, but then you kind of learn to describe the word that you're trying to convey, and therefore you're expanding your vocabulary in that way as well. Honestly, I think it's good for anybody who has a sincere desire to learn Spanish. I think one thing that I recognized was how I came into this program very much affects the dynamics of the group. So, each individual, it's individual goals that you come in with, but your attitude and the way in which you interact affects the group as a whole, and that really could positively change the dynamics of the group. Living with a host family is key, and I think that was one of the big draws to this program, and it definitely exceeded my expectation in that aspect of the constant immersion. I think the longer you're able to do the program, the better, but even if it's a short stay and if the teachers here are really experienced and are able to really tailor their teaching to the individual needs of the individual and the group as well. And I think all the teachers are really amazing here. I'll be doing 1 week of traveling around Costa Rica before I attend a 1-week board prep course for my oral board exam, and then I'll be starting real work in September. So.